Good morning, and I'm neither Steven Stites nor Dr. David Wild. I'm in for Dr. Steve Stites, who is our Chief Medical Officer. I'm Dr. Dana Hawkinson, the Medical Director of Infection Prevention and Control, and we are coming to you live from the Dolph Simons Jr. Family Broadcast Studio. Just ask any pediatrician, and they will tell you the pandemic is taking a toll on our youngest patients, from pediatric admissions to clinic visits to mental health. We've had an impressive panel today with Dr. Mike Lewis, who's the Medical Director of Inpatient Pediatrics and Pediatric Intensive Care, Dr. Stephen Lauer, pediatrician, and Dr. Stephen Lassen, pediatric psychologist. We will hear from them in just a moment, but first, let's look at our inpatient numbers, including some demographics around the COVID-19 infections that we have here in the hospital. Right now, Hays has 2 patients, 1 active and 1 recovery. But here in our health system, in our hospital, we have 23 active patients with 11 ICU patients and 3 on the ventilator. We still have 11 additional patients in that recovery period, so 34 active patients. As far as the ages, though, and this is good that we have our pediatricians on, we do have in the ICU, those patients in the ICU, we have an age range from 23 to 75. In our regular medical floor, we have 36 to 83 is our age range. But we do have a couple patients on our pediatric floor as well, and those patients are 10 and 17 years old, respectively, also. So as you can see, we continue to have a large range of people and ages. Don't have any COVID vaccination status updates for that, but we will be getting that as well. It gets a little bit harder as we get more and more patients in the hospital. So, but before we jump to to our discussion with our panelists, do we have any reporter questions?
Sure. Good morning. Cody Holyoke with Channel 9.
Hi, Cody.
Hey, guys. Hi. I'll piggyback off of what you said about pediatric patients. I'm getting this from a lot of viewers still as we're talking about the EUA for 12 to 15-year-olds on Pfizer. We're saying, you know, kids really don't get sick from the virus. Why should they get the vaccine? And I figured I would let you handle that one. Why is it so important?
Yeah, you know, I'll start off just from an epidemiologic standpoint. We understand there is in fact, a new research study that shows that people who are in households have a higher risk of getting the disease if children are in there, particularly, say, that older children rather than the elementary age children as well. But although we do know pediatrics patients or children don't get as sick, there is that risk of that severe illness, but there is also that risk of that multi-system inflammatory disease. And I'll just kind of put it to our pediatricians here.
Well, so as Dr. Hawkinson's mentioned, we do have a couple patients right now in the hospital here at KU who peds patients with COVID-19 infections. That comes with a range of kind of some of the older patients can have some issues from a respiratory status where they're going to have an oxygen requirement, which we've definitely seen in our older patients. And a lot of our younger patients also, we'll see them just with some high fevers and also dehydration. And so if they have any chronic medical conditions, those also start to become quite a bit more worse. Also in the discussion is, you know, as part of infection prevention here in the health system, what we do is everybody who gets admitted, so it doesn't matter why you're admitted to the hospital, you're still going to get a COVID-19 test, so that way we can help minimize any exposures. And if somebody has a need for something where they need to be working with a lot of team members, but they are COVID-19 positive, that also complicates a little bit of their care, and so you can see their length of stay be a little bit longer, as well as, I know Dr. Douglas has been on the show, I think as recently as last week. People who have COVID-19 also have mental health needs, and that becomes a lot more complicated to try to put somebody into now a pediatric mental health facility for a short stay. Oh, by the way, everybody needs to have COVID-19 infection prevention and infrastructure in place too.
Dr. Lauer, anything to add?
I just said I think the big one is people thinking forward to how we're going to get all our kids back to normal life, into school this fall, and the ability to do all their activities. And the way that's going to happen is to get the pandemic under control by expanding the vaccine down to 12. Now we've opened up another millions of people patients who could be vaccinated, and by vaccinating them help spread control the spread of the pandemic in our population. So yeah, it's as much to control the disease across our population as for those kids. The benefit is that it is going to help us get back to normal more quickly, help our kids get back to school, all the activities that they need to be involved in.
And just, Dr. Lassen, just pivoting this question a little bit specifically to you, what have you seen about kids? Is there a fear about getting it, or a fear about maybe spreading it to somebody in their household who may be more vulnerable as well?
Well, yes and yes. So all of the above. We've seen a lot of health-related anxiety, COVID-related anxiety emerge in kids over this past year. And for some of those kids, they had pre-existing anxiety disorders, mental health conditions that seem to have been exacerbated by all of this. But we've also seen just the emergence of some of it in kids who were functioning pretty well prior. And I think it varies a lot depending on how the parents have handled the situation. We know that kids really look to their families to know how to manage situations that are stressful and ambiguous. And so for families who are not managing as well, we find a disproportionate number of kids who are struggling also. But there are so many layers to the anxiety that kids experience with this, whether it's social isolation, it's academic difficulties, it's health of family, and then it tends to just spread from there into other areas.
All right. Did that answer your question, Cody?
Yeah, you touched on it just a little bit, Dr. Hawkinson, that, I mean, it's not just about the kids when we're talking about this vaccine, right? Because the kids go into households and meet with family members.
Yeah, but I think that's the story of this whole pandemic. It's not just about adults 65 and older, 80 and older, nursing home residents. It's not just about the United States. It's about everything, because we are interconnected. Households are interconnected. Our communities are interconnected. We know how easily this virus spreads. We know the extent to which supply chain problems can be an issue, capacity issues in the hospital. So everything is interconnected. But certainly households are so closely linked because people are living with one another very closely. And we know that pediatrics patients, children, can replicate the same amount of virus as adults. They can spread the virus is easy. And we know that living in households where somebody is infected has a higher rate of getting the other people in that household infected as well. Any other questions? No. All right. So, Dr. Lassen, we touched on this a little bit. We're going to pivot that question and kind of piggyback on that first question. Early on in the pandemic, we had talked about concerns around children's mental health resulting from stay-at-home orders and online schooling. Did we have a right to be concerned at that point?
Absolutely. Yeah. In fact, we're getting more and more data from around the world showing that kids are experiencing up to 2 and 3 times the number of mental health symptoms as pre-pandemic levels. So we're talking 20-30% of kids in some areas who are experiencing significant, mostly depression and anxiety, but also a whole host of mental health conditions. And so we certainly could see this coming as it unfolded, and we've seen a lot of that come to pass. I think one of the other interesting pieces of data, though, that we don't always focus on is that 60, 70, 80% of kids who are doing really well. And I think it's important for us to recognize that as challenging as this has been for a portion of the population, for a much greater number of kids, they've been able to do really well. And I think we need to understand that better. What is it that makes these kids and families who are doing well do so well? And we need to help share that and educate that with these other families and children.
So I guess what is most concerning, or what are some of the major concerns you have about the kids that you're seeing in your clinic?
Most of it, I think, is related to the social isolation and the educational changes that have happened. I think that's driving a lot of the mental health symptoms that we're seeing in clinics. And so we're interested in what that's going to look like when kids start to return to school more fully, more completely in the fall. But it's really hitting at the heart of really major areas for kids functioning. You think about how important social interaction and relationships are. You think about school, where they spend a majority of time in those early years. All of those things have been so affected and have really driven a lot of the anxiety, the sadness, the distress that we're seeing.
Thank you. So now, Dr. Lewis, you shared with us that hospital admissions for seasonal upper respiratory viruses have been down this year. That includes, but not certainly limited to, RSV and influenza. What do you attribute that lower number to?
Sure. Well, I think it's pretty straightforward from our perspective that wearing a mask and social distancing, all of the things that we've been doing to try to help minimize what the pandemic effect is on us as a society, has really also minimized for kids these average, what we call kind of just child upper respiratory illnesses, that sometimes can be a lower respiratory illness too. I think also a big part of that is that through like daycares and school, they've had a lot more just freedom to tell families, your child is sick, we really don't believe your child belongs here today. Mm-hmm. And they've felt much more support kind of from the community and also from society of just saying, if your kid is here and they're coughing and maybe they have a fever, they probably don't belong here today. And also I think some ability for some people, unfortunately not everybody, have flexibility to work from home. They've also been able to keep their kids at home and not have to rely maybe on daycare quite as much. But as things start to go back to normal, if you want to really say that, now people are going back into the workplace a little bit more, and so we're going to see kids back into that. You know, for a 12-month-old, a mask is really not going to be much of an opportunity, right? And so I think those are all things that we'll continue to see now as things start to evolve with where kids go and things.
Okay. So now coming up to the more recent times, what alarms you the most about admissions that we're seeing in the pediatrics units now?
Yeah. It's really sad. I don't know how else to put it. It's really sad is that we are not unique in this. This is across the country, whether I have friends who are in St. Louis or if I have friends other places. It's not a regional thing. This is across the country situation that because of COVID, many of these kids have not had the opportunity, maybe as a year ago, to go see their pediatrician, go see their doctor, where some of these things could have been maybe identified as starting to bubble up, as like Dr. Lassen talks about. And as a result, they've now kind of been without care for a while, and now they've really started to hit rock bottom. And as a result of that, and then probably not as much occupancy space in some of the child psychiatry hospitals, we are now holding patients because there's no other place for them who are having active thoughts about hurting themselves. And so you have those patients and you're trying to find a place for them, and it is not easy. And so we see this huge jump in that area, as well as a lot of kids, you know, a year ago, everybody, due to the concern with the pandemic, a lot of chronic conditions were under control. People were taking their maintenance medications. And now you see, as people have kind of just grown tired, some of that adherence and that consistency with those medications for their kids isn't there quite as much. And as a result, we're now starting to see some of those chronic conditions being admitted again, which probably could have been avoided if we had a little bit stronger consistency on a day-to-day basis with some of those medicines.
And Dr. Lauer, are you also seeing patients in your clinic with mental health issues, specifically related to COVID-19? And if so, you know, how are they presenting at that point?
Well, a lot of what we see has to do with comes across in their school performance. These many of them, you know, some maybe that you thought would have problems as the school systems had to pivot to online education, but others who are really have been kind of surprising. Ones who are doing very well. That it's just been a very big challenge, despite the best efforts of the educational system to get online schooling down. There's just been a lot of kids who have not done very well with it. So, you know, I think getting back to that, a lot of the presentation of school is not going well. They're not having that social support that they have from their friends normally every day, the support that they could get from teachers and counselors within the school system. So, yeah, it mainly that I see comes across as those kids when you just ask the question, so how's school going, has really led to open kind of that door to a lot of the depression and insecurity that Dr. Lassen was referring to.
Yeah, we know our teachers and especially our counselors in those schools are so vitally important. So now also Pfizer is expected to receive approval from the CDC, the ACIP, the Advisory Committee on Immunization Practices today. Will you advise your patients and their parents to encourage them to get that?
Yes, there's a really simple answer to this one. Yes, get your child vaccinated. This is again one of the ways that we're going to get our society as a whole out of this pandemic. It's another big group of the population that can acquire immunity without getting sick and without the potential of passing the illness on to others. So again, in the big goal of getting everybody back to a more normal setup, one of the fastest ways to do this is to get more people vaccinated. And with this new block of patients now being eligible down to age 12, the advice is going to be, let's get your kid vaccinated as quickly as we possibly can. Lots of work will be going on within our health system to figure out how to get that done as soon as possible. So that'll be the message. Get your child vaccinated.
We know that an obvious perk and benefit of these vaccines is individually, it significantly reduces your risk of disease and also long-haul problems afterward. What are some other benefits or perks from this vaccine to the individuals and the families as well?
Well, I think this question, just what are we going to be able to do as individuals over the summertime? So, a lot of families are able to get in some travel over the summer, which is probably going to be a good thing for those who can do it. But travel restrictions in many areas remain. Things as simple as going out and where can you go? What do recommendations say are safe ways to gather? So that, again, those social and family interactions where we've got, again, over the summertime, hopefully a lot of families able to get back together. But can that happen safely? Is everybody in that family going to be protected? And while the children may not be the ones at risk for getting sick, again, as you mentioned, they are the ones who are at risk for passing it on. And then as we get back into school, there are going to be questions about who can be in school, what role does vaccination screening play in having kids back in school. There's a lot of vaccine requirements every year for kids to be in school. So that's going to play into as well as how do we safely return to school, keep that environment as safe as possible for all the adults who are working there. So, again, there are going to be lots of benefits to those individuals and families to getting vaccinated in terms of freeing them up to return to normal activities.
100%, I agree with you. So last question before we get to some community questions, Dr. Lassen, I'll start with you. What can parents do to help identify maybe flags or issues of problems, and what can they do to help mitigate some of those issues?
So when we think about kids who might be struggling, we always want to be aware of significant changes that they demonstrate. So I would suggest, for parents who are noticing a significant change in any area of their child's life, that's something to pay attention to. And we need to start asking, why that might be happening, whether it's disrupted sleep, whether it's a change in mood or a change in activities that they're enjoying, wanting to do. All of those areas can be flags that something's not right for the child, and we need to investigate a little bit more and be communicating, provide some additional support there. As we accrue those kinds of changes, then we get more and more concerned. And so for kids who are unable to function effectively in a particular area of their life, then we really suggest that parents reach out to a professional and get some further assessment and support. But I think at more lower levels, when the changes aren't so severe, we need to really stress the foundations of parenting. We need to be communicating with kids. We need to be checking in with them, asking them how they're doing. We need to be making sure that they've got good support around them. We need to be communicating with the schools and trying to optimize their learning. And so I think all of this rests on a lot of good communication, which in stressful times can be difficult, right? Because parents are occupied, they're stressed by other things, but helping them really focus on their children is going to be important. So a range of things, other things that can be done for kids who have hobbies, activities, things that they enjoy. Parents need to be making sure that they're engaging in those activities to the extent that they can, and that they're wrapped in these social and family networks.
Dr. Lewis, any thoughts?
No, I echo a lot of what Dr. Lassen said, is that, so many of our kids have had a lot of things taken away from them, just like adults have. And if they don't truly have some of those skills to work through some of their frustrations, that we can see them really kind of go downward with their mental health. And so making sure you're checking in with them, seeing how their grades are. A lot of times you can kind of log in and have a sense of kind of where your kids' grades are. Any of those indicators, even if they say everything is fine, but you see things starting to slip in other areas, those are all things to sit down and talk with your kid and be like, so this is, I noticed this, and that sometimes that's uncomfortable as a parent, but think of it, you're their advocate. They don't always recognize when things are kind of going in the wrong direction. So please take a step forward and say that for them.
Yeah. Dr. Lauer?
I'd say the one thing that I've been stressing to families is trying to get back to some kind of structured life. A lot of this, I think, is the mental health problems especially have been related to this. Just all the structure in our children's lives has gone away, and so can we reestablish some of that? I think the families who have done well have managed to keep some structure around their kids' life, getting up, regular meal times, some activity, physical activity, regular bedtimes, and the more unstructured they've become, the more problematic it's been on an already tough situation. So all the things about good communication with your child, understanding where they sit, and then trying to provide some of that structure that they've had taken away from them by the pandemic.
Yeah, be engaged. And I understand it's hard for even adults to be engaged and process what has been going on. It can be even harder for the little children, especially those teenagers, with everything else going on in their brains and bodies as it is. So be engaged for sure. Jill, any community questions today?
We have quite a few community questions, as you might expect. I want to just say that I think routine for adults is a good thing too. So
that's right, sleep.
Good advice for mom and dad as well. Cindy wants to know, she's concerned that these mental health problems, are they going to last forever if they present as a result of COVID in these kids, or is this something we can get over?
Anyone?
Well, I think part of how we view mental health is we should view it in the same way as physical health. And so is that going to be there forever? Can it maybe be there present, but it's very, very controlled? That's a possibility. And that's why we'd say you probably want to engage with your kid's regular provider. And so whether just working through those things, because a lot of times, we can have a thing that's there always, and it might kind of bubble up at times, but keep it at here versus kind of hitting really big peaks is kind of where, really I think what we want to stress. And so, but every person's going to be different, so probably can't make a complete, is it going to be there forever?
And I would say that certainly there's individual variation that makes it difficult to make broad assumptions, but generally we have very good evidence-based treatments for all of these things. And if we can just get kids into treatment or get them the support that they need, they're going to do well. And kids generally are resilient to begin with, much more so than adults. There are some some exceptions to that, but generally kids do well bouncing back from challenges if they have adequate support. So I would say, Cindy, that absolutely we don't need to expect or anticipate that these things will continue to be challenging for kids unless we don't do anything about it. And then for sure they will continue if we neglect them.
All right.
Maggie writes, she said, in adults, stress can cause headaches, stomach aches, etc. Does it do the same in children?
Dr. Lauer, what do you think in your outpatient clinics? I'm sure you see a wide variety of this even before the pandemic.
Absolutely. It's the same story will come up in children of all ages, that as they're stressed, they'll present, not saying I'm stressed, they'll come in with some somatic complaint, just like you mentioned, headaches, stomach ache, kind of that very hard to pin down, but there's something that they're translating that stress into a physical symptom. So more and more of that is coming up. And when we talk to those kids, work through what's going on, frequently it comes down to just that they're stressed and presenting with those same kinds of symptoms that adults will. So yeah, very similar. And I think we have to keep that in mind always, the mental health aspect of any physical complaint that a patient comes in with.
That's crazy, because with little kids, you don't want to think about stress bothering them. So,
Yeah.
Christy wants to know, are young kids getting sicker with the new variant?
Dr. Lewis?
We've not really seen the degree of illness be any different with any of the variants at this point in time, really, for pediatrics. The illness itself has been typically relatively limited, but as we kind of talk about, it's not so much always directly their care, it's kind of in the home. And we talk a lot of times, like, to the families, like, if you, various activities and decisions, what does it mean if your kid has COVID in your house? Not looking at it in a vacuum for just your child, but what does it mean in your home if he or she has COVID-19? So, but we've not really seen any differences in the variants for illness for our kids.
Yeah, and I'd like to say, that question continues to be asked, and certainly that was asked, and it came up about the UK variant, B117, but there was a Lancet article published a few weeks ago which matched controls or variant patients with normal or pre-variant patients, which actually showed no increase in severity of disease. So, but that question will continue to be asked because we know variants are going to continue to pop up. So.
Okay, Melissa wants to know, can the doctors explain what exactly multi-system inflammatory syndrome does and what the timeline is between catching COVID and getting it and what to look for?
So I think we should view that as we kind of break kind of the definition of it down, because even at the very beginning it was starting to be a little bit hairy, as you know, we had a lot of conversations.
Yep.
But truly it means that more than one part of your body is starting to be impacted from what we'd call an inflammatory response. And that's what we've seen with COVID as a whole sometimes is that basically the immune system just goes into overdrive. And when it goes into overdrive, you'll see these fevers, or you start to see multiple organs be impacted by it. So whether that's their kidneys, frequently we keep hearing in pediatrics, like, what is the cardiac impact of a COVID-19 infection, either in the acute phase, but also afterwards. And so it can impact various organs, but more than one usually. So a lot of times we actually see if they have MIS-C, that they might also have some GI symptoms. When they very first started coming out as conversation pieces out of the UK, we saw that just about every one of those patients also had GI symptoms. So at that point, we're like, okay, so it's not just respiratory. We know that there's also kind of a GI perspective. A lot of them had diarrhea and vomiting. So that's kind of where I would say is multiple things that are going on at once with your kid, more than just a runny nose or those types of things. The timing can be a little bit difficult. We have seen kids who've been kind of towards the tail end almost of what we'd call their active infection, but we've also seen kids that also have probably been a few weeks out from that as well. So again, I think that's why it's a really important thing, not only for, as we talked about earlier, of getting to see your pediatrician, make sure that everything is going well from a mental health perspective, but there's been a lot of kids who have had COVID-19. and they're now wanting to go back to their activities and their athletic events and things. Well, they need to have a physical done by their pediatrician, and part of that discussion is, should they have an EKG done? And so those are things that can be done in the pediatrician's office to be clearing them to go back to those activities as well.
Anything to add?
Joanne wants to know, is the dosage of the vaccine the same for children?
I believe it is. I
Yeah.
think they were initially trying to decide, but I believe that it is the same
Yep,
dose for Pfizer.
it is right now at the Pfizer vaccine. Same vial that an adult or a 12-year-old would get their vaccine from.
Yeah. And I would like to say, those are very small, minute doses for an adult or a child. The amount of active substance or any of those substances within those vaccines, any of the components, is extremely minute compared to other things you may come into contact with every day, and that's either inhaling, ingesting, anything like that. So.
Okay, Sally writes that in Blue Valley, they've been back to school since October in a hybrid situation in middle and high school, and she wants to know, is that helping or hurting?
I think, Dr. Lassen, you talked a little bit
Yeah.
about on a case-by-case situation, but
Yeah, I think for some it's been very helpful. It's helped them reintegrate into those educational and social systems. Again, we have a fair amount of children who have done well in the virtual environment. They tend to be the ones that were doing well before. And so this seems to have disproportionately impacted, different populations. But for a number of kids that we see in our clinics, they have reported a lot of benefit to getting back into that school environment. Dr. Lauer talked about the structure. We can't emphasize structure enough when we're talking about kids. That brings a degree of comfort and predictability into their lives. And so it's been very helpful to see some of that, and we're looking forward to more of that in the fall, and to really establishing that structure again for kids and relieving parents of a lot of what they've been burdened with doing at home in a virtual environment.
Yeah, and I don't understand if the question means individually, is it helping these children and their psyche and their physical health and activity, or is it hurting? But also on the global picture, we know that when schools opened up, there were more cases. And it wasn't necessarily within the school environment, because all of those mitigation items were taken care of. Masking, the distancing as much as possible, not eating, say in the cafeteria, and doing all of those things. Another good recent article that just came out to say that. And we understand that a lot of the children were still getting the disease or bringing it home in those extracurricular activities. So is it helping or hurting? We know that as things open up, there are just more people interacting with more people. So the virus does have that potential to spread. All the more reason why vaccination is so important for children and adults.
Beth writes, my 15-year-old son recently got his second HPV vaccine. How long should he wait to get his COVID vaccine?
That's great. So I'm going to start here, and I'll pass it to my experts. The guidance is 2 weeks either side of any vaccine. You want to separate those. So again, in my liver transplant clinics or for my HIV patients, I sometimes give 2 or 3 different vaccines together, and that would be the pneumonia vaccine, the shingles vaccine, influenza vaccine. But because of the lack of data on safety and efficacy, which right now I believe it's probably safe, the guidance is you want to separate any COVID vaccine from any other vaccine from 2 weeks, by 2 weeks, unless there are extenuating circumstances. And I know that here in our clinic, when we were vaccinating healthcare workers, we'd actually given it 2 or 3 days after, say, a tetanus vaccine. But that's the current guidance, and that is just because of lack of data on that. But we are actually having that active discussion for more than one reason, and Dr. Lewis and I were talking yesterday about that.
Yeah, that's a very timely question. Is now as we have all of these adolescents who will be coming in this summer probably for these their well exams, that whether it's their meningitis vaccine or HPV vaccine, that it now becomes a lot more time invested to get these vaccines. And so Dr. Lauer, Dr. Hawkinson, and I were very involved in this conversation yesterday, and it's still ongoing, of how do we want to do this appropriately, because we want to make sure We're addressing what those kids need to be able to go back to school because they need their meningitis vaccine if they're due for it. We also believe strongly about the HPV vaccine, how amazing you can prevent cancer with a vaccine, as well as the coronavirus vaccine in terms of from our society and being able to get back to moving forward as a society. And so how we are balancing that is definitely something we're putting a microscope on right now as a health system for our kids. But right now, as Dr. Hawkinson said, the CDC is nudging people to say you should think seriously about having a 2-week window before and after that vaccine, any other vaccine before the coronavirus vaccine.
Dr. Lauer, anything?
Yeah, it's going to be a risk-benefit analysis. Again, the known risk of not getting an HPV vaccine, of missing that chance to have that adolescent get that vaccine, and then increasing their lifelong risk of cancer, versus just the unknown about what would be the effect of the coronavirus vaccine, just because it's so new. So. Yeah, it's going to be a challenging one. We'll have to work that through and then have lots of conversations with families, as we always do, about vaccines, about what's the best thing for that individual child.
But and I would expect the American Academy of Pediatrics, just as we've seen with other things in the pandemic and COVID, there will be baby steps, and I think there will probably be a reevaluation because of those reasons that you stated. But I applaud you. Parents, please get your sons and daughters vaccinated for HPV. It will save them. It will help them down the line, and it's very important to do.
2 quick questions,
Okay.
and then I know you guys got to wrap it up. Michael is from Denver, Colorado. He's an athlete.
Mm-hmm.
It's a word problem. He's playing in
Yeah.
the state of Kansas,
Yeah.
but staying in a hotel in Missouri for 4 days before competition with a negative PCR test. His question is, does he have to quarantine?
I haven't looked at the travel guidance recently from KDHE. I don't believe there's any specific quarantine or travel guidance of that nature from other states that I'm aware
Colorado,
of.
I think, was getting added to KDHE
Okay.
here recently. So as he kind of talks about that,
Dr. Norman's in tomorrow. Maybe
Yeah,
we can
that's
ask
gotta
him that.
say-
And I can review the travel. I just haven't reviewed it so long because there really hasn't been anything unless you're traveling in from another country. So.
yeah.
Right. Okay. Anil gets our last question today,
Yeah,
and it's on
of course he
topic.
does.
He's worried about, he said, you've mentioned that kids reflect the adults' reactions to stressors.
Mm-hmm.
He's wondering whether there are issues or a higher rate among single parents
Mm-hmm.
who have financial status. And not single parents, but where you have one parent that is now financially supporting the family.
Well, to the extent that there's additional stressors in the family, I think that that's something to take note of and conveys additional risk for the children. But it's a good point of emphasis that in times of stress, that kids will look to their parents and their caregivers to know how to respond. And so a good point to end our questions on, to make sure that we're paying attention to our parents and our caregivers, because we can't just be treating and supporting kids in isolation, because they don't exist in isolation. They exist within this family system. And so making sure that parents have access to resources as well, that they're being supported. I don't know of any research to date that addresses that specific issue, but I think from the data we do have, we can assume that there's going to be additional risk for single parents and those who are struggling financially, emotionally, or in any other way.
Yeah. All right. Well, thank you to the community and to our media. Tomorrow, we have another full panel of experts. We have KDHE Secretary Dr. Lee Norman, Vice Chair of Clinical and Translational Research at KU, University of Kansas Medical Center, Dr. Mario Castro, and Research Director of Pediatrics and Infectious Diseases at Children's Mercy, Dr. Barbara Pahoud, who will be with us and will be answering more vaccine questions. Please join us. Any final thoughts today, Dr. Lauer?
I think that while there's a lot of questions, we understand that the answer to getting back to normal, getting your kids back into their activities with the families and to schools, is to get them vaccinated. So have those discussions, and then as soon as possible, get them in so that they can get vaccinated.
Dr. Lewis.
That's absolutely on point. If we want to keep talking about moving forward as a community and a society to truly get on top and stay on top of COVID-19, the more people who have immunity via vaccine is the way to go.
Dr. Lassen.
I guess I would end with just a plea for us to maintain balance in our lives and to not get too wrapped up in the difficulty or the changes, but to really focus on what works for us and for our kids. Focus on getting adequate sleep and nutrition, some physical activity. Focus on doing the things that we know contribute to optimal emotional health, and enjoy the activities that we have to enjoy and not worry too much about what's down the road.
And I'll just have 2 points. You know, we are very fortunate here in the United States. We have a lot of first world privilege. Please, we have adequate supply of vaccines. Please, parents, get your children vaccinated. We know that during the pandemic, a lot of vaccination programs around the world for simple diseases that we can prevent children from suffering from were stopped. We are fortunate here in the United States. Please, go get your children vaccinated. Protect them from those vaccine preventable diseases. Also, you know, get that HPV vaccine, protect them from cancer down the road. If your child is old enough, get them the meningococcal vaccine. And when you're able to, please get the COVID-19 vaccine. Allow them to continue to be well and not miss participation days or camp days or travel days because they have COVID-19. That is my final thought, but I do have one final thing. I would like to wish happy birthday to my sister, Amy, who is up at the University of Wisconsin-Madison Health System. She is a frontline worker and a nurse and has been sacrificing since the pandemic started with protecting patients and her coworkers, supporting her family, doing all that stuff. So happy birthday, and you know, hope you get a little bit of time off and rest and time to yourself today. So with that, we will see you tomorrow. Again, we have a panel of experts, and we'll be happy to answer more questions. Thank you very much.